9-30, 2020 board meeting. I'm Greg Lippy, president of the board. Before we convene, I advise all individuals observing or participating in the meeting that the meeting is being conducted consistent with the provisions of Governor Gavin Newsom's Executive Order N-29-20. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. All lines are currently on mute. As I facilitate the meeting, lines will remain on mute until I ask staff to open lines for public comments. I will announce when we are accepting public comment. I've advised staff to allot 2 minutes to each individual providing comments. This approach is necessary to facilitate the meeting and ensure the board has the opportunity to complete its necessary business. I appreciate everyone's understanding and patience as we navigate this meeting format. Before we get started, will the staff moderating the meeting please provide general instructions? Moderator?
Hello, this is the moderator of the meeting. Welcome to the pharmacy board meeting. Before we get started, I would like to... Hi, are you able to hear me?
Now. Yeah, you cut out for a minute. Are you back?
Before we get started, I would like to remind board members and senior staff who are not... No? Oh, apologies. Let me start over. Okay. I am. Can you hear me?
Mm-hmm. Yes. I can't hear you now, though.
Okay. Actually, before I get started, I see that board member Wong has joined.
Okay.
This is a moderator. Let me do the call-in option real quick. So my audio is a little bit fixed. Give me one moment while I can.
Okay. Sure, thanks.
Hello, this is the moderator. Are you able to hear me now?
Yes.
Okay, wonderful. Before I get started with my opening remarks, I see that board member Wong has joined. I'll go ahead and promote him up to a panelist.
Thank you.
Board member Wong, if you could please unmute your microphone to do a quick mic check.
Yes, I'm here. Can you guys hear me?
Yes.
Yes, we can hear you, but you're a little quiet. You may want to put the microphone just a little bit closer to your face.
Okay. Can you hear better now?
Yes.
Yes, I can. Thank you.
All right.
All right. This is the moderator. I'll go ahead and start over with my opening remarks. Before we get started, I would like to remind board members and senior staff who are not speaking to please mute your microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will interject with a brief friendly reminder or simply mute your microphone. To facilitate public comment today, we will be utilizing the WebEx question and answer feature. When the board president reaches a point in the agenda in which public comment is appropriate, public comment will be requested. At the board's direction, I will turn on and announce the opening of the Q&A feature. And as a reminder, if a member of the public would like to participate in public comment, they must enter the WebEx event through the link that was provided with the agenda. Members of the public can indicate that they would like to make a comment by clicking on the icon with a question mark within a square located at the bottom center of their WebEx screen. We'll share instructions on the screen each time for your reference. In the Ask field, typically in the lower right-hand corner of the WebEx screen, members of the public who wish to make a public comment will type, "I would like to make a public comment," and send to all panelists. Any other communication will not be responded to. I will take comments in the order that they are received, and I will call on members of the public and unmute their microphone. When the member of the public will then be given 2 minutes to make their comment and given a 10-second time warning, and at the conclusion, their microphone will be muted. And after that, we will move on to the next member of the public who has comment. Please note that the Q&A feature is only being used as a means for the members of the public to represent that they would like to make a verbal comment. Once unmuted, the member of the public may verbally state their comment. This is not a means to ask questions of the moderator or members of the board. Such inquiries submitted using this feature will not be answered. If any attendees utilize a profane name, they will not be called upon to prevent members of the public from being subjected to profane language. While you are free to express criticism or negative views, for sake of the members of the public participating on the call, please do not use profane language when making public comments to the board. If you do not have a microphone, please click on the Communicate at the top of your screen, then select Audio Connection, call in Audio Connection. If you need further assistance, please refer to the How to Join DCA WebEx event guide provided with the board meeting link. And that concludes my opening comments. Thank you.
President Lippy, your line is muted.
Thank you. I was just practicing. There will be one change to today's schedule. At 3 p.m., the board will convene in closed session. At the end of closed session, we will adjourn for the day. Due to technological limitations, adjournment will not be broadcast. Adjournment will immediately follow closed session, and there will be no other items of business discussed. At approximately 11:20, I will ask for a 10-minute break. And at approximately 12:30, we will break for lunch for 40 minutes. I will now take a roll call to establish a quorum. Members, as I call your names, please remember to open your line before speaking. Okay, first, Ryan Brooks. Thank you.
I'm here.
Cheryl Butler. Cheryl, can you
I'm
unmute?
here.
Oh, great, thank you. Okay, Shirley Kemp. Shirley, are you unmuted? Okay, I'll skip for the moment.
President Lippy, I do not believe that board member Kim is able to participate today.
Okay, thank you for letting me know. Okay, Maria Serpa.
Here.
Thank you. Debbie Veal.
Here.
Thank you. Jig Patel.
Good morning. I'm here.
Thank you. Albert Wong. Albert, you unmuted?
Good morning.
Thank you.
Albert Wong's here.
Ricardo Sanchez.
Ricardo Sanchez here.
Thank you. And Sung Oh.
I'm here.
Thank you. Okay, a quorum has been established. The board will now entertain any public comments for items not on the agenda. To facilitate this portion of the meeting, as I previously announced, staff will open up the phone line for individuals to provide public comment. You're not required to identify yourself, but you may do so. As we open the lines, I remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Members, following the review of the public comments for this agenda item, I will ask you to comment on what, if any, items should be placed on a future agenda. Moderator, please open the lines for public comment.
All right, this is the moderator, and at the direction of the board, I will open up the Q&A panel for public comment. Members of the public, if you would like to make a public comment, please click on that icon with a question mark within a square located at the bottom center of your WebEx screen. We currently have instructions available for you, and it looks like we do have one person who has requested public comment, Danny Martinez. Give me one moment while I get my timer up.
Okay.
Danny, when I unmute your microphone, you will be given 2 minutes to speak and a 10-second warning. Danny, I am unmuting your microphone now.
Good morning, board members. Danny Martinez with the California Pharmacists Association. I'd like to ask that the board place an item on the future agenda of the Enforcement and Compounding Committee dealing with Code of Federal Regulations, CFR 530.15, or I'm sorry, 530.13. We recently have been receiving reports from our membership that the board is now have begun to issue orders of correction dealing with compounding of veterinary drug products. And we believe that in the spirit of education of the membership, that this item should be agendized at the Enforcement and Compounding Committee meeting to go over what current law states, what it means, so that there's no confusion between any licensee or board inspector or any of that sort. We believe that there could possibly be some confusion in interpretation from both sides, on the licensee and on the board side. So in the spirit of education and issuing clarity regarding these regulations related to animal compounding, we'd like to request that this item be agendized.
Thank you, Danny. Okay, members, having received public comment, you can close the lines now, moderator. Yes.
Mr. President?
Sorry. Yes, Maria?
This is
Yes.
Maria. I'd like to make a suggestion on how to move forward on the public comment.
Sure, go ahead.
I'd like to ask the staff to review the federal law that was mentioned to see if there have been any recent changes to the law. And at that point, we could determine whether to put on a future Enforcement and Compounding Committee meeting.
Very good. Thank you. Are there any other member comments regarding public comment?
This is the moderator. There were no public comments. We have closed the Q&A at your direction.
Thank you. Given no more member comments, I'll move on to agenda item 3. Next item on the agenda is approval of the June 18, 2020 board meeting minutes. Members, are there any comments on the minutes? Do I hear a comment coming? Okay. Please remember to open your line if you do have a comment. If not, I will now entertain a motion to approve the minutes as discussed. Members, please remember to open your line and identify.
Ryan Brooks, so moved.
Debbie Veal, second.
Thank you, Ryan. Thank you, Debbie. Okay, I'll now take a roll call. Maria Serpa.
Yes.
Thank you.
Mr. President, please, I'm not sure I heard
public comment?
Public comment, yeah.
Okay. Is there any public comment on the meetings, on the minutes of the June 18th meeting?
All right, this is the moderator. We've opened up the Q&A portion for public comment again. Members of the public, if you would like to make public comment, please click on that question mark within a square located at the bottom center of your WebEx screen. And it looks like at this time there are no requests for public comment. Would you like me to close the Q&A panel?
Yes, please.
Great, the Q&A panel is now closed.
Okay, we have a motion, we have a second. I'll begin the voting. Maria Serpa?
Support,
Thank
yes.
you. Debbie Veal?
Yes.
Thank you. Sung Oh?
Yes.
Thank you. Ricardo Sanchez?
Yes.
Thank you. Jig Patel.
Yes.
Thank you. Cheryl Butler.
Yes.
Thank you.
If you think this is, if part of this.
What's happening? Okay, Albert Wong. Albert, are you unmuted? You have a vote? I'll skip for the moment. Ryan Brooks.
Yes.
Thank you. Okay, I'm back to Albert. Albert Wong.
It shows that he's muted, Greg.
Okay, Albert, unmute, please. Okay, I'll just, we have a quorum, so I'll just put that down as an abstention for now. I vote yes. Motion passes. We'll move on. Okay. Next item, item 4, for action is an update from the Department of Consumer Affairs. Please welcome Carrie Holmes, Deputy Director of Board and Bureau Relations. Moderator, please open the line for Ms. Holmes.
Good morning, board members. I'm Carrie Holmes, Deputy Director, Board and Bureau Relations at the Department of Consumer Affairs. Thank you for allowing me to give this update to the Pharmacy Board. I was just appointed by Governor Newsom to serve as Deputy Director for Board and Bureau Relations beginning June 1st. I most recently came from the Senate, where I was Legislative Director for Senator Jim Bell. Before my time in the legislature, I served at the Secretary of State's office as an assistant deputy. I've always been passionate about consumer protection, and I'm very happy to be here at DCA working with all the boards and bureaus. I'm part of a new leadership team, as you know. In January, Governor Newsom appointed Lourdes Castro Ramirez as the new Secretary of Business, Consumer Services, and Housing Agency effective March 2nd. On March 5th, Governor Newsom appointed Jennifer Simoes as DCA's Deputy Director of Legislation. And finally, on April 16th, Christine Lally was appointed by Governor Newsom as the Chief Deputy Director of DCA, and she joined us this month. Ms. Lally most recently served as Deputy Director of the Medical Board of California. As you may recall from her January update, Director Kirkmeyer laid out several of her priorities, including improving the regulations process and timelines. Now that she has her team in place, she will be able to devote even more time to this priority. DCA's regulations unit was created by DCA to directly assist boards and bureaus with their regulations packages. The department also developed an online system to electronically manage and track regulations packages and streamline their review. It's called Sharewell. Sharewell testing with the pilot cohort is now complete, and there will be regular check-ins with the pilot groups to solicit feedback, and the feedback will be evaluated to determine the next stages of the rollout plan. Our work continues, even though COVID-19 has changed the way we do business now and in the future. DCA temporarily closed all offices to the public in March in response to state and local stay-at-home orders to help reduce the spread of COVID-19. DCA and the boards and bureaus have implemented telework plans and have required physical distancing for those employees who cannot telework. DCA offices reopened to the public on June 15th with preventative measures to safeguard the health and safety of our employees and visitors. We are truly grateful to you for the continued service and to your staff who are being so flexible. I know your board has 5 staff working on contact tracing, and I want to thank you for that. Your staff is playing another key role out doing compliance inspections, making sure that masks are worn. All of this public health work is so vital, not only to keeping people safe and healthy, but also to keep more of our economy and services open. As you well know, during the state of emergency, DCA has also been busy issuing waivers needed to maintain a licensed workforce during COVID-19. To date, DCA has issued 38 waivers ranging from continuing education requirements, telehealth, and licensure reinstatements. I'd like to ask you to look at the existing waivers and other changes that have affected your board and licensees. What might be helpful to keep in the long run? DCA is looking at areas where changes could be made on an ongoing basis and welcomes any feedback or ideas you have. Finally, DCA has moved to providing our board member orientation training onto an online WebEx format, and I'm happy to report it's been going very well. Board members have an obligation to complete this training within 1 year of reappointment or appointment. So if you haven't had a chance to sign up yet, your next opportunity will be in October. I look forward to getting to know you and your programs better. I hope the day comes soon when we can meet in person. In the meantime, if you have any questions or need anything from DCA, please don't hesitate to reach out. I am new, so I may not have an answer for you today, but I will find it. I'm here to help. Thank you again for inviting me to your meeting. This concludes my presentation. Thank you.
Thank you, Carrie. Members, do you have any questions or comments for Ms. Holmes? As a reminder, please unmute your line if you do. No questions? Okay, thank you again, Carrie.
Thank you.
Mr. President, can you ask the
Yes.
public if they have any questions? Thank
Yes. Moderator, please open the line for individuals wishing to provide public comment or ask questions.
All right, this is the moderator. At the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a public comment, please click on that icon with a question mark and a square located at the bottom center of your WebEx screen. We're currently sharing instructions on the screen for your reference. I'll pause a moment just to give members of the public time to access that Q&A feature. All right, at this time, it looks like there are no requests for public comment. Would you like me to close the Q&A feature?
Yes, please.
All right, Q&A feature is now closed.
Okay, we're moving on to agenda item 5. Members, as included in the meeting materials, will now consider the proposed regulations to amend Title 16 CCR sections 1780 to 1783. This relates to dangerous drug distributors and third-party logistics providers. The proposed language, as noticed, is provided in the meeting materials. Meeting materials indicate that no comments were received during the 45-day public comment period. Members, for our consideration today, we can adopt the regulation as noticed, or we can amend the regulation to address any concerns and notice the regulation for an additional 15-day comment period. Any comments by members at this point? Okay, no comments. I would recommend adoption. Do we have a motion to do so? No motion? Okay.
Hi, Brad. This is Sung. I can make a motion.
Okay, thank you, Sung. Do we have a second?
This is Cheryl. I will second.
Thank you, Cheryl. Now I'm going to ask for public comment. Moderator, please open the lines.
All right, this is the moderator. Direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a public comment, please click on that question mark within a square located at the bottom center of your WebEx screen. I'll pause. Oh, and it looks like we do have someone who wishes to make public comment.
Okay.
Individual identified as Stephen Gray. Stephen, you'll be given 2 minutes to speak and a 10-second warning. I am unmuting your microphone now.
Thank you very much for the opportunity to comment. First of all, I'd like to say that I support this regulation as published. I do think, though, that given the fact that there are substantial differences in the standards from the USP reference that is in the current regulation to the one that will be in the, quote, latest edition as specified in this regulation, that the board needs to consider some education and also a phase-in period, as there could be substantial investment needed and time needed for wholesalers and 3PLs to make the adjustments in their temperature, humidity, and other environmental changes per the more recent USP standards. Thank you.
Thank you, Steve.
All right, this is the moderator again, and that was the last individual who identified for public comment. Would you like me to close the Q&A feature now?
Yes, please.
Right, Q&A feature is now closed.
Okay. Based on the comment received, do either the person who made the motion, well, does the person who made the motion want to change their motion in any way? No? Okay.
No.
Okay, thank you. Okay, all those in favor of the motion, I'm going to call your names now.
And Mr. President, can I just confirm that the motion was as stated in the materials to adopt the regulatory language as noticed and delegate to the executive officer to make technical or non-substantive changes as required?
That is the motion. Is that correct, Sung?
Yep, sure.
Thank you. Okay, now I'll take the vote. Albert Wong?
Yes. Yes.
Thank you. Jig Patel?
Yes.
Thank you. Ricardo Sanchez?
Yes.
Thank you. Cheryl Butler?
Yes.
Cheryl, are you unmuted? Okay, thank you. Okay. Ryan Brooks?
Yes.
Thank you. Debbie Veal?
Yes.
Thank you. Sung Ho?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you, and I vote yes. The motion's adopted. Agenda item 6. I will now turn the meeting over to Debbie Veal, our Vice President and Chairperson for the Licensing Committee, to give the Licensing Committee report. Debbie, you're up.
Thank you, President Lippy. For the Licensing Committee, we have a couple items to discuss. The first one is discussion and consideration of legislative proposal to expand the authority of pharmacists to order and administer immunizations approved by the FDA to prevent a vaccine preventable disease. So there's a couple current business laws, business and profession codes that regulate us on this, on administering immunizations. And specifically, 4052.8 establishes when a pharmacist may independently initiate and administer licensed vaccines, but it's based on the ACIP schedule. As a nation in California, as we all know, we are trying to respond to our current pandemic, the COVID-19. And it is a good time to look at our policies and ensure that California is positioned and ready to deploy vaccine, the COVID-19 vaccine, once approved by the FDA in response to the current health crisis, but also to be ready to respond to future situations. The FDA Center for Biologic Evaluation Research, CBER, is responsible for regulating the vaccines in the United States. Vaccine clinical development follows a very similar pathway as drugs and other biologicals. A sponsor who wishes to begin clinical trials with the vaccine must submit an investigational new drug application to the FDA, which describes the vaccine, its method of manufacture, quality control, testing for release. Also included is information is the vaccine safety and the ability to elicit a protective immunoresponse and animal testing, as well as proposed clinical protocol for studies in humans. Vaccine approval also requires the provision of adequate product labeling to allow healthcare professionals to understand the vaccine's proper use, including its potential benefits and risks, to communicate with patients and parents, and to safely administer the vaccine to the public. During the meeting, the members spoke in support of a policy to expand the authority of pharmacists to initiate and administer FDA-approved vaccines. Further, the committee advised of a recent amended legislation, AB 1710 Woods, seeking to facilitate such authority. The members and the public discussed both the proposal provided by the committees for the committee's consideration, as well as a broader approach being offered in the legislation. The committee directed the staff to broaden the committee's proposal to reflect similar approach as AB 17. Further, as part of the meeting, the public comment suggested that a policy proposal should allow pharmacists to order and administer immunizations when the vaccine is authorized by the FDA versus when the FDA has approved the vaccine. After consideration, the committee the committee recommendation was to stick with the FDA approval of vaccines and to move forward with the broadening of the statutory proposal to be consistent with the language in AB 17 to administer vaccines that are approved by the FDA and to move forward with the recommendation to the full board in July. Further, the staff and the committee chair to work with legal counsel to modify the language based on the policy. So subsequent to the meeting, the staff amended the proposed amendment to Professions Code 4052.4 to incorporate the policy changes requested by the committee. Board staff recommends that the proposal establish the authority for FDA-approved vaccines. So if you look on attachment 1, you'll see that the change in 402.8A, it says, in addition to the authority approved in paragraph 11 of subdivision A of section 4052, a pharmacist may independently initiate and administer vaccines, and this is the change, approved by the Federal Food and Drug Administration for persons 3 years of age or older. So I think we need is it correct, Noreen, that we need a motion since we did not have this exact language at the committee meeting?
Yes, a motion would be advisable.
So I don't know if one of the licensing committee members, Cheryl or Albert, would you like to make a motion for the board to accept the change to 4052.8?
So move.
Ms. Fielk, could I just suggest perhaps a clarification on the process that's being suggested? Are you suggesting that the board go forward with a legislative, to seek an author and a legislative change on that?
Yes, we are. Oh, I'm sorry, Albert, it's your motion, so.
So move.
Yes, he means.
And I don't know, Cheryl, do you want to second his motion?
I will second the motion.
Okay.
I think, board, our hope is actually that AB 1610 is actually passed and enacted, hopefully even with emergency, so that once the COVID vaccine is out, we'll be able to immediately administer it. But, this is the recommendation of the committee, is that we move with language that is parallel to 1710.
This is Ann Sodergren. I apologize for the interruption. Would the board consider or be agreeable to a motion that directs staff to work towards implementing this policy, whether through an existing vehicle or through a new vehicle, rather than just directing us to pursue a separate measure?
So Albert, I think that is what our intent is. Would you modify your motion to align with what Ann just said?
Yes.
And Cheryl, are you okay seconding that?
Yes, I will second that.
Thank you, Ann, for the clarification.
Okay. Now you're going to ask for public comment?
How about
Yes,
member
please.
comment? Member comment first?
Sure.
Hi, a couple of questions for Dr. Veal and the rest of the committee. This is Maria Serpa. In looking at 1710, I think it's AB 1710, the wording has added the information about FDA, but it did not do any of the striking. And I actually like the more inclusive information so that it is broadening the regulation to include those that are approved by the FDA, but it doesn't strike the others. In the bill, it says by the FDA or, and then the rest of the process or the rest of the language continues. Our proposed change to the regulation does not match that. And I would like to have some comment as to why was the importance of striking that language when I see the addition, but I'm not quite sure about the striking part. I actually like having a little bit more information.
So Maria, I'll take a stab at it, Ann, and if you need to maybe embellish what I say, feel free to do so. But normally what happens with the ACIP is they would never put a vaccine or immunization on their schedule until it had been approved by the FDA. So having or, FDA would always happen first. So it seemed like there was not a need to include the addition of the ACIP piece to this regulation.
And I can understand that part of it, but my concern is it's the or adds additional information as to when these vaccines are appropriate, not just in what situations, because we're looking at all vaccines. You know, you're looking at typhoid and cholera and all the vaccines. So when and who gets administered is strictly published by the CDC. I'm not so familiar with ACIP, but I would suggest that we just put that in our regulation also to help the inspectors and to help the licensed public to understand that they have other resources other than the package insert as to determine when to initiate therapies. It's more of an educational for our inspectors and for the licensed public. So it wouldn't preclude them from giving it. It just gives them more information about where to look.
So does any choose to change the motion?
Yeah, I guess, you know, if you read on in the, in B1, it does bring up the CDC and the ACIP. I'm not sure it needs to be part of when a pharmacist can initiate and administer. If you look at B, it says, in order to initiate and administer, a pharmacist shall do the following. Number one, complete immunization training endorsed by the CDC and the ACIP. So, I mean, doesn't that tell the pharmacist, I mean, isn't that part of being a professional that's what you've been trained on? So I guess I try to keep legislation, regulations simple versus duplicative. That's
I can understand that. I think that it's B1 doesn't really cover it. So because that's talking about a training program that is the program is endorsed. So I'm just asking about, and I'll stop talking after this, is to match the language that's currently in AB 1710 would be ideal, where it has the word or. But I'm sure if it's not an issue for the other members or for the public, then.
Hi, Debbie. I actually do hear Maria, and I agree. This is Song. I do absolutely agree. I think it's possible to do both FDA or ACIP. I think that their process for approving these is a little different, so it may be prudent to have both ability if possible.
Well, you say or, so that means either one would happen, and the FDA will always happen first. But, you know, honestly, I'm hoping that 1710 is what happens before our, because I think it's going to take a lot longer for our regulation to have, you know, to occur. So, you know, 1710 is probably what's going to happen. So if you want to align it exactly with 1710, I don't think that there's a problem there. Yeah, I'm not actually in agreement with you, but I don't think that there's a problem with doing it. Because I think 1710, once again, I pray to God gets passed, and because that's probably what we're going to end up, you know, using to be able to do this, at least specifically for COVID.
Okay, so Albert, you want to change your motion, and Cheryl, you want to second it, or what do you want to do?
Dr. Veal, can I chime in before you look at a change in the motion?
Sure.
The way I see 1710, it looks to me like the approval by FDA sort of swallows the current language that is shown as struck in the committee's recommendation. So I think that gets somewhat confusing. I think what I hear Member Serpa talking about is a standard of practice issue.
I would agree.
Which the board might want to consider implementing through some regulation, or as I think as you were talking about earlier, that's what the training of a pharmacist should be training on. I think you can do it either way. I just am not sure about the language in 1710, because if it is adopted, approved by FDA, if the immunization is approved by FDA, then if it's also on the list, I think that swallows it. And if it's not on the list, then I think perhaps there's some confusion. Well, am I allowed to do it, or am I only allowed to do it if it's on the list? So I would suggest you either look at language that says that it's either approved by FDA or possibly approved by FDA and for consideration on the list, or just leave it as it is. But obviously that's not the wish of the committee. To make sure that it's clear.
Yeah, I think the wish of the committee is to leave it as it is, but I think if the board feels like we need to include the other language, then I think the committee will.
I just question whether or not including the other language that's in 1710 doesn't create some confusion, because the approval by FDA, as far as I understand it, would just swallow that second portion of it. And if so, then does that create some lack of clarity about what a pharmacist would be authorized to do?
And I agree with you, Noreen, that I think it is a standard of practice. And so I don't think we need to have it, but I don't know. Can we hear from other board members if they wish? Or maybe why don't we vote, and if it gets voted down, then we can change the motion.
Okay, first we'll get public comment.
And so what the current motion is, can we get some clarification, just because we've been talking about it, make sure that the public
the current motion
is aware
is
of what the current motion is?
Yeah, the current motion is to accept the language that's presented in our material.
Okay. Well, let's go ahead with public comment. Maybe it'll change some thinking. Okay. Go ahead,
This is the
moderator.
moderator. I'll go ahead and open up the Q&A portion for public comment. All right, members of the public, if you would like to make a public comment, please click on the icon with a question mark within a square located at the bottom center of your WebEx screen. All right, it looks like we do have two individuals who have identified, a couple people. So we'll go ahead and get started with our first person, Danny Martinez. One moment.
Unmute.
Let me find Danny in my attendee list. All right. Danny, you will be given 2 minutes to speak and a 10-second warning. You are unmuted now.
Thank you. Danny Martinez with the California Pharmacists Association. We are the sponsor of AB 1710. I did mention this during the committee meeting that while we appreciate the board's efforts to support this effort, we figured that it would just make it easier for the board itself to just support AB 1710 as a kind of like a solution to this whole thing. Later in this committee meeting, you, under the legislation and regulation report, you have AB 1710 listed on the agenda as something to be voted on. I think would like to reiterate our desire to simply support AB 1710 as a solution, just to kind of meet in the middle for everyone, and to not. What we don't want is we don't want having competing measures out there for any reason. 1710 is going to be adjudicated this year at some point, and again, we don't want conflicting messages out there. And so I'm happy to answer any questions about anything of how or why we drafted it the way we did.
Yeah, Danny, why don't you tell us why you did put the or in?
So the or is as Maria stated, it is more to allow for allow the current vaccines on the ACIP list to be used. What we intended to do is we still want to respect the ACIP process and the CDC process. We recognize both the FDA and the CDC as being two separate entities with different purposes. And so, but in cases where you have the COVID pandemic, where that process could take a while, and we have, I'm sorry. Anyways, if we can extend my time, I can answer, but we want to respect both processes.
Can we request to extend Danny's speaking time, please?
Yeah, we can extend for a response to a question of a board member.
All right, Danny, your line is still unmuted.
Okay, so the CDC, as I mentioned, the CDC and the FDA have different purposes for this. In this time of the pandemic, time is of the essence, which is why we issued the or in there to allow, if a COVID vaccine happens to be implemented before or in a reasonable time period, then we don't have to wait for the ACIP list. We still want to respect the work of the CDC and the ACIP list and the Federal Advisory Committee. So we don't, that's why we didn't eliminate it. And I hope that makes sense to everyone.
Well, I guess so. It kind of gets to what Noreen was saying. So we're talking about COVID. That's great, but we also have to look at the future because this is going to become a regulation. So I understand what Noreen's saying too. Is then that even just how you explained it, then it becomes maybe a little confusing. Which is more important? I mean, so in the case of COVID, gosh, it's important to get the COVID out. But is the intent to say, so a lot of times the FDA approval, that's great, but really you should wait for the CDC, ACIP. That seems to be what you're saying.
Yeah, I mean, it's one of the, we, again, want to respect the agencies and their work that they do. We, again, recognize time is of the essence in certain situations. We don't want to change existing law to take away an avenue for approval of vaccines. Or for it to be on the ACIP list. This is how we drafted it after consulting with pharmacists and our partners on this, that this would be the most effective way to keep current law as is and get a COVID vaccine out to patients as quickly as possible.
Yeah, I mean, I don't argue the COVID. I guess I'm thinking, you know, in the future, I just want to make sure we aren't creating anything that's confusing, because I would think that the standard of practice would say that an individual pharmacist would look to the CDC and the ACIP. But, you know, I agree with you also that we don't want to have conflicting messages out there, because we, you know, for COVID's sake, the pharmacists need to be able to administer this vaccine.
So then I would again respectfully ask that you consider just you know, voting on supporting AB 10 since 1710, since it is on the agenda later on, and I feel like that would make everything much easier.
Okay, thank you, Danny. Let's go on to the next comment. Thank you.
All right, this is the moderator. I'll go ahead and mute Danny, and we'll move on to the next individual who has requested public comment. Stephen Gray. Stephen, you'll be given 2 minutes to speak and a 10-second warning. I am unmuting your microphone now.
Thank you very much for the opportunity to comment on this. It's very important to get the language as clear as possible. I agree with the committee's language, which strikes out the language in the current 1710. If you look at that language very carefully in 1710, it is confusing, and the phrase after the FDA, which is in parentheses, comma, or, that phrase could be read to only apply to the ACIP. And then after that, it talks about and published by the Center for Disease Control. So this could be read to say that it's FDA approved or ACIP, but you still have to wait for it to be published by the Center for Disease Control. And I think that's another way this language is confusing. And I think it meets the committee's intention better and is more clear to simply eliminate that language all from or all the way down to after CDC for persons 3 years of age or older. So I support the committee's recommendation for language over the 1710 for those reasons. Thank you.
Thank you, Steve.
All right, this is the moderator. We will move on to the next individual who has requested public comment. Individual identified as Lindsay Gulahorn. All right, Lindsay, you will be given 2 minutes to speak and a 10-second warning. I am unmuting your microphone now.
Great, thank you. This is Lindsay Gulahorn. I represent the California Retailers Association and the National Association of Chain Drugstores, and we do strongly support AB 1710. We also support the board's proposal. However, in order to further broaden access to the COVID-19 vaccine once it's available, we recommend that the language be amended to use the term FDA authorized as opposed to FDA approved. This would ensure that it would be inclusive of both vaccines under investigation by the FDA and vaccines approved by the FDA. The COVID-19 vaccine could be first introduced via an expedited route, the emergency use authorization. So using the term FDA authorized will allow pharmacists to administer the vaccine while it's in this phase and get it out to the public more quickly. Thank you.
Thank you, Lindsay. Okay, moderator, next person.
Yes, I'm trying to mute Lindsay, and unfortunately, not letting me. Oh, there we go. Okay, now we'll move on to the next individual. Individual identified as Robert Stein. Robert, you'll be given 2 minutes to speak and a 10-second warning. And I am unmuting your microphone now.
Good morning. Thank you for allowing me to comment. My only comment has to do with exactly the issue that we're talking about in terms of the urgency of getting this change made. And that is that currently 1710 does not contain an urgency clause, which means that it will not go into effect until January 1st of 2021. If a vaccine is available sometime before that, we'd be precluded from doing that unless there is that urgency clause as part of the bill. Thanks.
Thank you.
All right, this is the moderator, and that was the last individual who has requested public comment. Would you like me to close the Q&A panel now?
Yes, please.
Okay, Q&A panel is now closed.
Debbie, back to you.
I would recommend that we go ahead and vote on the motion we have so we can just basically poll the board members. I think that will sort out whether the board members want to go with the committee language or if they want to consider 1710 or adding FDA authorized. So I would like to call for the vote.
Very good. Okay. Brian Brooks, your vote, please.
Yes.
Thank you. Cheryl Butler? Cheryl, thank you.
Yes.
Thank you. Maria Serpa?
No.
Okay. Debbie Veal?
Yes.
Okay. Jig Patel?
Yes.
Thank you. Albert Wong?
Yes.
Thank you. Ricardo Sanchez?
Yes.
Thank you. Sung Ho?
Yes.
Thank you. And I will go with yes. Motion passes. Okay. Debbie, are you can finish the report.
Okay, I'm moving on to agenda item B, which is discussion and consideration of the pharmacist's authority to perform CLIA waived tests for COVID-19. So there's numerous relevant law. I'm not going to go through all of it because it's there's a lot of it. So let me just kind of give you a background. On May 12th, DCA Director Kirchmeier issued a waiver to allow for pharmacists to order and administer COVID-19 tests in California, and that waiver was good for 60 days. Again, on July 7th, DCA Director Kirchmeier extended or issued a second waiver that extended this allowance for pharmacists until September 9th. A guidance document was issued at the same time with details regarding the temporary authority given to pharmacists. And it's important to notice that the waiver does not allow pharmacists to process the sample at the pharmacy unless the pharmacy is licensed as a clinical laboratory and meets all the requirements of BPC 1265. During the June 18th board meeting, a member of the public requested a future agenda item to discuss the issue of pharmacists performing CLIA waived COVID-19 antigen testing. The commentator indicated that the current situation is rather murky in terms of whether a pharmacist is able to actually perform such a test, as they have, if they have CLIA waived equipment and reagents. As part of the comments, the members were advised that CDPH has determined that COVID-19 testing shall only be performed in an appropriately licensed lab under the direction of a lab director. So during our meeting, we considered the relevant law, which gave the pharmacist the authority to administer tests, which reside in both pharmacy law as well as provisions of BPC code. The committee discussed and noted that under the provision of existing law, pharmacists are able to perform CLIA waived tests, which are limited to specific tests under 4052-4, which authorizes, quote unquote, the pharmacist's routine patient assessment procedures. However, the provisions are limited to blood glucose, hemoglobin A1C, or cholesterol tests. These tests can also be processed at the pharmacy if the pharmacy is appropriate licensed by CDPH, Laboratory Field Services. Aside from the DCA waiver, there is no provisional law that allows the pharmacist to order, collect specimens, and process the specimens of the COVID-19 test. Further, pharmacists, unless fully licensed as clinical lab directors under Laboratory Field Services, cannot process specimens. The committee had a couple presentations on the current legal provisions and provisions for testing under DCA director's issued waiver, how we could expand testing if additional authority could be granted to pharmacists. The committee was told that 42 states allow pharmacists to perform end-to-end testing. In other words, ordering, administering, and performing the test. Presenters requested that the committee and the board enhance the advocacy efforts within the administration to facilitate the broader authorities. The committee spoke in support of expansion and noted that cross-jurisdictional issues would need to be resolved. The committee suggested engaging with DCA and California Department of Public Health is necessary to expand access to testing and to facilitate more robust use of point-of-care testing that allows for more timely access of test results. Subsequent to the meeting, updated testing guidance was released by CDPH. As indicated in the guidance, CDPH recommends first prioritizing testing of hospitalized individuals with signs of COVID, followed by testing of other symptomatic individuals and higher risk asymptomatic individuals, and then other asymptomatic individuals when current conditions exist. This guidance should be used as for prioritization of patient population as well as for purposes of guiding laboratories and managing specimen processes. Attachment 2 includes the relevant law, the DCA issued waivers, and the guidance documents related to the waiver and the recent CDPH guidance, testing guidance. So at this point, Ann, I don't know if there's any comments you want to make other than the committee felt pretty strong that we needed to kind of work within the system. I believe the California Pharmacists Association, maybe Danny is planning on speaking up, but that an executive order from the governor at this point is what is going to be necessary in order to get a waiver in place for pharmacists to be able to do end-to-end testing. And so that's been addressed. As indicated in my earlier comments, we felt like we needed to make sure we engaged DCA and worked with California Department of Public Health to, bring about a solution. And is there anything else you'd like to add or any updated information that you'd like to share?
Thank you. So I think that the challenge is things that are, outside of the span of control for the board. So really our role here really needs to be one of advocacy because I think that in general, I think the board recognizes that CLIA waived tests and administering them is definitely consistent with the KSAs of a pharmacist. And so because of the cross-jurisdictional issues, the committee really indicated the importance of advocating for consideration to expand through some sort of authority change, either through an executive order. A legislative change could also be pursued, but that has time limitations as well. So I think that the focus is really on the advocacy and the education to see if there are opportunities for us to partner with other areas of the administration to see if we can create additional opportunities for this testing in the point of care arena.
Thank you, Ann. Let me kind of throw it out to the other board members. Do you have any comments or questions? I want to underline that I think the committee feels strongly that we would like to get to a point where the pharmacists can do end-to-end testing on more than just those 3 items, and preferably include COVID. But like Ann said, at this point, it's not something that we can will. It's something that we can advocate for. Other board comment or committee comment?
Hi, Debbie, this is Jig. I do advocate for those and for other tests like flu and other point-of-care tests that pharmacists can do. I think it will benefit the public quite a bit, especially during times like this.
I agree with you, Jig. I think it's something that our committee can work with the executive officer and, and other departments within DCA and outside to try to move this forward. And maybe COVID can lay the groundwork to do it.
Okay, Noreen, would we need a motion to do the advocacy?
I think it would be a good idea for the board to do a motion on this so that Anne can go forward and advocate the board's policy position on it.
Okay, thank you.
I can make the motion, Greg. That's very important.
Okay, we have a motion. Do we have a second?
I'll second.
Okay, thank you. Just for the record, the motion was done by, was it Jig?
Hi, that was me, Song. Sorry, Greg.
Sung? Okay, sorry, I didn't hear. And the second was by who?
It was, this is Cheryl Butler.
Cheryl. Okay, thank you, Cheryl. Okay. All right, we have a motion, we have a second, and do we have any more member comments? Okay, it's time to get some public comments. So, moderator, could you open the lines, please?
All right, this is the moderator, and at the direction of the board, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a public comment, please click on that question mark within a square located at the bottom center of your WebEx screen. It looks like we do have one individual so far, Danny Martinez. Danny, you'll be given 2 minutes to speak and a 10-second warning, and I am unmuting your microphone now.
Thank you. I absolutely agree with everything Debbie said, so please note that for the record in the minutes that that we agree. And I'm here to fully support that. Happy to answer any questions about the presentation that CPHA and ACDS presented. Thanks.
Thank you, Danny.
All right, and our next individual who has requested public comment, individual identified as Stacy S. Stacy, you'll be given 2 minutes to speak and a 10-second warning. And I am unmuting your microphone now.
Hi, thank you. Can you hear me?
Yes.
Oh, good. It still shows muted on my end. I would just like to say thank you so much to the board for looking into this and being supportive. I would also request that the board review the federal law related to these testings, because arguably there is federal law that has been issued that would preempt the state law allowing pharmacists to perform these tests. And to also, what I'm sure you already know, but emphasize that timing is of the essence here, and whatever the quickest way is to get to this, and if that is reaching out directly to the governor and asking for something to be issued, we need to be able to have pharmacists testing yesterday. So whatever the fastest possible way to that end, even if it's only temporarily for COVID and later for other items, would greatly be appreciated.
Thank you, Stacy.
Hey, Noreen, I have a question about what Stacy just said, that the federal law would preempt state law. I was thinking that whichever one is tighter, I don't know what the right word is.
The strongest.
What'd you say, Greg?
I just said the strongest.
Or the narrowest in scope.
Right.
That's the one that that rules. And in this case, I would think the state law would rule. Do you agree, or is Stacy correct that we could use federal law if it allows pharmacists to do end-to-end testing?
The issue of preemption is one that takes a fair amount of analysis to look at whether or not the federal law was meant to preempt the field. So offhand, I could not give an answer as to which one was, say, greater public protection, or what might allow or authorize a pharmacist to do it. So that I, offhand, without looking at the particular federal laws and seeing whether it was meant to preempt state law, it's hard to say. It is something that we can look at. However, while Ms. Sodergren prepares to educate the DCA and the other departments that might be involved with respect to the board's policy on it.
Yes, and I would like to keep this on our agenda because both with the COVID view and then as Dr. Patel mentioned, possibly opening up testing for other things, I think the committee would be very interested in understanding if the federal, and I'm not sure if the federal was just over COVID or not, but I think it's something we should make sure we understand. And I think it would be helpful in your advocacy of this viewpoint.
Yeah, happy to do so. I believe that what that commenter was referring to was guidance that was issued with respect to that, with the declaration and liability. I think that it has been evaluated, but I'm happy absolutely to follow up on that and see if that is something that can be used to support the board's policy. Absolutely.
Thank you.
Thank you.
Excuse me, this is Cheryl Butler. I have a question. I thought that this was about the end-to-end test. Currently, pharmacists are passing out the test. So I thought this was the question of pharmacists being able to take, to be able to be in the process of the end-to-end. I thought that's what we were talking about here.
It is.
Yeah, it is, Cheryl. It's about the end part, processing the specimen. So you're right. We can, I think via the waiver we were able to hand out and, collect and administer the test. It's just that we can't process it.
Correct.
Thank you. Thank you.
Okay, Greg, I'm going to move on
Okay.
to agenda item C.
Well, wait, we have to vote.
Oh,
This
I'm
is the
sorry.
moderator. We still have some individuals who
we
requested
still have
public
more
comment.
individuals? Okay.
Apologies.
That's okay.
So our next individual is individual identified as Lindsay Gulahorn. Lindsay, you'll be given 2 minutes to speak and a 10-second warning, and I'm unmuting your microphone now.
Thank you. Thank you. This is Lindsay with the California Retailers Association and National Association of Chain Drugstores. And I just want to echo what Danny Martinez said. We fully support the board's efforts here. We support expanding the ability of pharmacists to perform end-to-end tests, and we are here as a resource if you need us. Thank you.
Thank you, Lindsay. Okay, moderator, are there any other people waiting?
This is the moderator. Checking with Ann Sodergren, Danny Martinez has requested if he could clarify the federal law for the board, if you wish.
Okay.
Danny, I will unmute your microphone now.
Hi, thank you. So just for clarification, what the comments regarding the federal law issue is, back in April 8th, the Secretary of Health and Human Services issued a declaration under what's known as the PrEP Act, which stands for the Public Readiness and Emergency Preparedness Act. And under that act, they stated that pharmacists are deemed to be, quote, qualified persons to order and administer covered countermeasures in relation to the COVID-19 pandemic. Subsequently, there was confusion because under the PrEP Act, any declaration that is made by the secretary or their subordinate, authorized subordinate, cannot be, it expressly preempts any state or local legal requirement that prohibits or effectively prohibits a qualified person from ordering and administering a covered countermeasure pursuant to the secretary's declaration. I'm reading from an opinion that was issued by the Office of General Counsel. The secretary did designate licensed pharmacists as qualified persons for purposes of administering FDA authorized COVID-19 tests independent of state licensing laws. So that's what the commenter is referring to. This has been stated to CDPH and to the governor's office on both CPHA's and NACDS's behalf. There's been no movement on this, but I just wanted to clarify that for the committee.
Thank you, Danny.
Danny, but that's what we currently can do is order
Right.
and administer, and I think we're trying to be able to process. So the PrEP Act did not give pharmacists the ability to process the test.
I didn't read the whole opinion because it's several pages long, but in this case, the administering at the federal level essentially means the end-to-end, so even the processing part of it.
Okay.
So I'd be happy to forward to Ann and to the rest of the committee the entirety of the legal opinion that was issued, because it further explains it in there, but it does encompass the end-to-end process.
Yeah, please do.
Yeah, we would appreciate if you would share that with Ann.
So we already have it, and I can't speak to everything that the administration has done. However, it is my understanding that the administration is very aware and has considered that. I cannot represent the administration at all, but they are aware of and have arrived at the conclusions that they have.
Okay, thank you.
All right, and that was the last individual to request public comment. Would you like me to close the Q&A feature now?
Yes, thank you.
All right, Q&A feature is now closed.
Okay, we'll now vote on the motion, and that is for the advocacy. So I'll start with Maria Serpa.
Yes.
Thank you. Debbie Veal.
Yes.
Thank you. Sung Oh.
Yes.
Thank you. Ricardo Sanchez.
Yes.
Thank you. Jig Patel.
Yes.
Thank you. Cheryl Butler.
Yes.
Thank you. Albert Wong.
Yes.
Thank you. Ryan Brooks.
Yes.
Thank you. And I vote yes. The motion passes. Debbie, continue with your report, please.
Okay, agenda item C, which is update on implementation of SB 159, which is the HIV, PEP, and PrEP. So during our meeting in July, we reported to the committee on the status of the board provided training program, and the training program is still under development in collaboration with our subject matter experts, specifically from the Office of AIDS. Consistent with the emergency regulation, a training program, so it's not just our training program, but there can be other training programs, and a training program has to either be approved by the board or provided by a provider accredited by an approved accreditation agency, including ACPE or the California Pharmacists Association. And the board is aware that the California Society of Health System Pharmacists has completed a training program, which will be offered, as we understand, at no charge. And I believe the first viewing of the program is today. We also came to our attention that the pharmacist letter has also released a training program on PEP and PrEP. I'm not sure that one is necessarily free. So the board program will be coming out probably this fall, and to date, no one has come through the board with requests for approval of their training program. Attachment 3 does have the regulation that we're discussing. In addition, when we were talking about SB 159 and PEP and PrEP and training, there was a comment from the public regarding if the language allows schools of pharmacy curriculum, if that would also allow for schools of pharmacy curriculum to cover the training. And what's up on the screen now, hopefully you have WebEx and you can see on the screen, is a change that we would like to propose. And this was a change that was done in conjunction with myself and the executive officer, just to clarify that our intent was that a curriculum from a school of pharmacy in the state of California could be used to in place of a PEP and PrEP training program. So we would like to have a motion. I'd like to have a motion to make this change, this clarification, so that that our colleges of pharmacy in California would be able to put this into their training program, and so that the new grads would come out of school with training in PEP and PrEP to be able to take care of these patients.
Okay, is there a motion by somebody?
So
And
moved.
I'll go ahead and make the motion if someone, since no one from my committee has actually had a chance. We kind of discussed this, and this was kind of the.
I think Albert just.
I make the motion. I make the motion.
Okay. All right, thanks, Albert. I'll second it. This is Debbie. I'll second it.
Okay. Very good.
I think before we move on, though, there is one thing, and Noreen, I don't know if you wanted to, I understand that you might have a concern. In our language, we say from accredited California School of Pharmacy.
I do have, I can speak to that a little bit. I do have some concern about specifying it's California School of Pharmacy, because I don't quite, unless it's required of a California school to provide the training as part of the curriculum, I'm not sure I see a reason to distinguish between the California schools and any other accredited program or accredited school, recognized school. I had initially understood some of the discussion at the committee level to say that it was now generally part of an approved curriculum, but I may have overthought that. If it is generally considered part of a curriculum, I don't have a problem with saying any recognized school, but without a requirement that it be part of a California curriculum, I see an issue with allowing or authorizing a California school and not any other accredited school.
Well, I think the individual that was speaking was from a California School of Pharmacy, so I think that was our basis. So we don't know if this is part of a curriculum or required in a curriculum in any other state. But I guess
it's not required.
If another state were to have it, I guess as long as they taught PEP and PrEP and it aligned with our regulations and they received approval as through ACPE as this is part of their curriculum, then you're saying it should be okay if it's from another state. Is that what you're saying?
I'm saying is if the standard for education is changing and it is included as part of an accredited curriculum now, then I don't see any problem with requiring it as part of a curriculum after a certain date from any accredited school. I'm just not sure I see a basis for authorizing California school program to qualify without it actually being either a part of California's curriculum or any other basis for distinguishing between the California school and another school.
But we don't know. We know it's part. We heard that it's part of the California curriculum. We haven't heard it's part of other states. So we don't know.
I'm not sure hearing that it's a part of the curriculum is going to be sufficient to make the distinction between California schools and others.
So would the understanding be if we just said this from an accredited school of pharmacy and take out the word California, that another school of pharmacy would have to meet our requirements for the training program?
Well, I think if you were to do that, what you're saying is we do recognize any accredited school as having that as part of their curriculum.
This is Anne.
But no, but that's not what we're saying. We're not saying that this is your College of Pharmacy, you have it part of your curriculum. I'm saying the opposite. I'm saying if we say it's from an accredited school of pharmacy, so how do we, do we need to reword this so as long as the training is included in the degree program? What says as part of, I mean, it seems like it says the training program approved by the board.
You can maybe come up with language that says if the registrar of an accredited school attests to the fact that it was part of the curriculum of the qualifying degree completed after such and such a date, you can do something like that. But I think Ms. Sodergren has something that she wanted to add in there.
So to me, it seems like there may be an opportunity to keep the language itself clear enough so that the regulated public understands what the board's expectation is, but then in the initial statement of reasons, lay out how we're going to confirm it. So perhaps it's, if it's part of curriculum, right, of a qualifying degree program, on or after this date. And then in the initial statement of reasons, we can clarify or indicate that confirmation of that could be from or, through a registrar or through the dean's signature as a way to try to simplify it a little bit, but still ensure that it's understood that we will be independently verifying that through either the registrar or the dean.
And so, Anne, we do not put that actually in its regulation. We just put that, where's that information included?
So I would suggest in the initial statement of reasons, which is part of the rulemaking process, but it is not memorialized in the regulation language itself.
Okay. So then, and then we would drop the word California from our proposed change.
Yes, to me that seems, but I think council would need to confirm whether or not we can do that. That seems like a path potential.
Because this is where you're going to spell out what a person is required to establish or a licensee is required to establish in order to initiate and furnish PEP and PrEP. I think this is, the language is where it should be spelled out. So if you're going to make sure that the person has has shown by the, that the licensee is able to show by a letter from the registrar that is part of the curriculum. Otherwise, I'm not quite sure what the board would be looking at in determining whether or not the person has successfully completed the training.
All right, Noreen, why don't you give us recommended language?
If you give me a minute to think about it. If you're not thinking that the training is currently part of a curriculum of a recognized school and that all around the country that training is still evolving, but you want to be able to allow the training to be part of a curriculum, right. I'm going to need just a minute to think about it.
Why don't you work on it, and why don't we come back to it?
Yeah, why don't we get
and actually now would be a good time to take a 10-minute break.
Okay.
So why don't we do that and let Noreen think about it and reconvene in 10 minutes.
Okay, sounds good.
Okay, moderator, could you, thank you.